All right, let's talk about the NCLEX. If you're prepping for it, it can feel like this giant, confusing maze, right? Well, today we're going to change that. We're going to turn all that chaos into a super clear 5-step battle plan. Let's dive in.
So, does this look familiar? That feeling of just being completely overwhelmed by NCLEX prep? I mean, it's like an avalanche of advice, isn't it? You've got question banks, study guides, videos. It's so easy to feel totally buried before you've even started studying.
But hey, don't worry, that's exactly why we're here. We're going to cut through all that noise together. We're going to build a simple, structured roadmap that'll give you the confidence you need and a really clear path to passing this thing. So here's our game plan. First up, we're going straight to the source, the official blueprint. Then we'll get into the incredible power of practice questions. After that, we'll talk about videos, guides, and all that other good stuff. Then we'll put it all together and craft your study plan. And to wrap it all up, we've got some amazing final tips from people who've actually been there and passed. Okay, let's jump into our first step. And honestly, this is the most important one. We are starting with the source of truth. Seriously, before you buy a single book or watch one video, you have to get familiar with the official test plan. So the people who actually make the test, the National Council of State Boards of Nursing, or NCSBN for short, they give this thing away for free. It's the official blueprint for the entire exam. It literally tells you exactly what they expect you to know. I mean, think about it. It's like being handed the playbook before the championship game. You'd be crazy not to read it, right? And this is the core of that playbook. See, everything on the NCLEX gets broken down into these client needs categories. The official plan tells you exactly what they are. For example, the biggest chunk of your exam, that's going to be physiological integrity, basic care and comfort. But you also have huge sections like safe and effective care environment and psychosocial integrity. The magic is that the plan gives you the percentage breakdown for each one, so you know exactly where to focus your study time. No more guessing.
Okay, so now you know what you need to study. The next big question is, how do you study it? Well, the single most powerful tool in your entire arsenal is going to be the practice question bank, what everyone calls a Q bank.
And yeah, you are seeing that number correctly. Over 1,500 questions. That's what successful test takers are doing on average. And look, this isn't about memorizing answers. It's about sheer volume and repetition. You're literally training your brain to see the patterns and to think in that special NCLEX way.
But here's why it works so well. It builds your endurance, it shows you all the different kind of weird question formats, but the most important thing, the absolute key is that last point. It's not about getting it right, it's about understanding the rationale. The real gold is figuring out why the right answer is right, and, just as crucially, why all the other answers are wrong. That's where the learning really happens.
So practice questions are your foundation, for sure. But what happens when you keep getting questions wrong about, say, cardiac meds, and you realize you just don't get it? Well, that's where the next part of your cool kit comes in, content review. And here's a really critical distinction to make, passive versus active learning. It's super easy to just put on a video lecture and kind of zone out, right? That's passive. Active learning is when you engage with it. You answer a practice question, you make flashcards, or, and this is a great trick, you try explaining the concept out loud, even if it's just to your wall. That process of actively recalling the info is what really makes it stick. And you know what the best part is? There are so many fantastic free resources out there to help you do this. You've got amazing video channels like Registered Nurse RN and Simple Nursing. The Mark Klimek lectures are legendary. There are study guides, Quizlet flashcard sets. All of these are perfect for filling in those little knowledge gaps you find when you're grinding through your practice questions.
Okay, so you've got the blueprint. You've got your tools, the Q banks, the videos, the guides. Now it's time to assemble your arsenal and build a battle plan that is customized just for you.
And it's really a simple 4-step process. Step 1. Assess yourself. Take a practice test and be honest about where you're weak. Step 2. Schedule it. Actually block out time in your calendar for studying, like it's an appointment you absolutely cannot miss. 3. Integrate. This is where you combine practice questions with that targeted content review. And finally, Step 4. Simulate. You got to take full-length, timed practice tests to build up that mental endurance for the real thing.
All right, let's get to our final section, and this is some of my favorite stuff. This is pure wisdom, straight from the people who have been in the trenches and have already conquered the NCLEX.
Okay, we've said it before, but I'm going to say it again because this is the #1 tip for a reason. Read the rationales. Seriously, even for the questions you got right.
Understanding the why is everything. This is what shifts you from just memorizing facts to actually developing the clinical judgment the NCLEX is designed to test.
Now this next one, so many people fall into this trap. It's so tempting to buy 10 different QBanks and subscribe to every review course, right? But that just leads to what they call analysis paralysis. The best advice is to find 1 or 2 really high-quality resources and just stick with them. Go deep, not wide. Quality over quantity every single time.
And finally, this might be the hardest advice to follow, but it is so important. The day before your test, do not study. Think about it. You wouldn't run a 10K the day before a marathon, right? Your brain is a muscle and it needs to rest and recover. Your only job that day is to relax, watch a movie, go for a walk, do anything but study. You have to trust the preparation you've already done.
So there you have it. That's your arsenal. You have the official blueprint. You know the power of practice questions and content review. And you've got a framework for a solid plan. You have all the tools. The only question left is, are you ready to become a nurse? You can do this. You got this.